meeting of the Tompkins County Council of Governments. And so I guess, does anyone have anything to add to the agenda?
I might wonder what happened to the agenda because I didn't get any meeting materials. Am I the only one?
Mine got dumped to spam. Mine got dumped to spam, and fortunately, Katrina helped me find it today.
Okay. That could have happened.
The agendas were sent out on Monday.
I got mine.
Okay.
Oh.
Yeah, I missed.
Okay. And Katrina did send out an additional item earlier today for the
That
resolution.
I got.
Great. Okay. Super.
Just go to the website.
Great. Okay. With that, I will move on to call for approval of the minutes of June 25th.
I'll move for approval.
Okay. Any discussion or comments?
One little typographical error on page 5 of the minutes, first paragraph under legislative term limits. It says, following the 20210 census data. I think there's one too many twos there. Minor change.
Okay. Thanks, Bob. Any other comments or additions or corrections? Great. Okay. Thank you. So I'll call for a vote on approval of the minutes of June 25th. All in favor?
Aye.
Aye.
Opposed? Great. Thank you. And now
Abstain.
we have an abstention there. Sorry, I didn't call for an abstention. But
Since I didn't sit, I wasn't willing to vote.
okay.
A or nay.
Okay. Fair enough. Do we have a report from county administration? I'm guessing not. So if Jason or anyone shows up later, we'll work them in. So with that, I'll move on to item number 5, which is a presentation on the medical countermeasures plan by Nina Saili.
Hello. I'd like to thank you for inviting me to speak to you today. The information that I'm going to be speaking about is going to be very new information to you. So at the end of the presentation, I will email out the slides and some additional handouts to Kathy so that she can get them out to you. I've also put slide numbers in the presentation. So if at the end of the presentation you have questions and we need to refer to a slide, just make sure to jot that slide number down. And I am going to attempt to share my screen. Did that work?
Yep. Yes. Great.
Okay. One of the ways that the CDC supports local government is by providing some grant funding for public health preparedness. So as the Tompkins County Public Health Preparedness Coordinator, I have the responsibility to write several public health related response plans and to train county employees and volunteers on those plans. One of our response plans is called the Medical Countermeasures Plan, or it might be called the MCM plan. You'll hear me refer it to. It's going to be the centerpiece of our initial discussion, and then I'm going to segue into how mass vaccination during pandemic response ties in. When we think about a medical countermeasure, it's actually a product that can be used in an event of any type of public health emergency that could stem from a naturally occurring emerging disease, a natural disaster, or it could be an event caused by a terrorist attack stemming from biological, chemical, radiological, or nuclear materials. The really important thing to remember about a medical countermeasure is that it's a preventative measure. It's a prophylaxis. It is not a treatment. Treatments need to be done in hospitals by medical professionals. So when the medical countermeasure first became a requirement by states and counties, it stemmed from the anthrax attacks post 9/11. And so it's really based on the bioterrorism threats that you see on the slide. These agents, and there are other agents that go along with them, are considered Category A agents. The CDC has defined Category A, B, and C, but we tailor our plan toward Category A agents. And the reason for that is because these pathogens are going to pose the highest risk to public and national security because they're going to spread easily from person to person. They're going to cause a high death rate. They're going to have potential for major public health impacts. They could cause public panic, social disruption, and there are going to be very special requirements and actions for a public health response. The country has a strategic national stockpile for, since the inception of the SNS, the CDC has managed it, but in the last couple of years, they have handed it over to the Federal Department of Health and Human Services. The stockpile contains a lot of the antibiotics, the antivirals, and the equipment that would be necessary to respond to natural disasters or biological terrorism events. All of the requests for these supplies locally have to go through the Department of Emergency Response up to the State Office of Emergency Management, and then they'll be funneled over to the appropriate federal agency. So once the strategic national stockpile or elements of it are requested by a county, the way that those medicines, if it's a medicine, it's a vaccine, the way that those are provided to our community is called through points of dispensing. And every county plan is going to be different. For our county plan, we use 2 different types of points of dispensing. Other counties only use 1, or they'll devise alternate and maybe have 3 or 4 methods of dispensing. So the first one that's in our plan is called an open pod. And an open pod is one that's going to be managed by the health department. It's also going to be staffed by health department staff and volunteers that we coordinate for. Open pods are open to the general public. And this is really what differentiates them from a closed pod plan. So a closed pod plan is actually a concept that we only started using, I think it was about 5 or 6 years ago. I realized that open pods put a huge drain on the health department and county employees. And so by coming up with a closed pod concept, I was able to reach out to local businesses, institutions, and agencies and ask them if they would be willing to dispense medication to the people that worked within their institutions or were associated with their institutions. So a closed pod is closed off to the general public and is only operated to support the people who are associated with that organization or agency. But it's done in conjunction with open pods, and all pods are monitored, by the health department. So let's talk about how this would work in kind of big picture. Any strategic national stockpile assets are going to come into the county to the staging site. Meanwhile, the public health director is going to decide what open pods he wants to open. Once that's decided and those pods are staffed, the assets will get pushed out to those pods. Now, while all of this is happening, our PIOs are developing public messaging. And the messaging that goes out is going to explain what's going on with the event, what an open pod is, where they're going to be located, what times they'll be open or activated, what to bring, what not to bring. And then when those messages go out and the pod doors open, people will go to probably the pod that is either located in proximity to where they work or live. Now, when we think about how to incorporate closed pods into the same scenario, all assets will still come to the county. But when the public health director looks at the pods he has available, he may determine that there are closed pod partners that would be appropriate to ask them to activate their pod. The memorandums of agreement that we have with our closed pod partners do not require them to activate. If they're asked to activate, they do have the option of pulling back and saying, no, this is not something we can support at this time. But if they do decide to activate, the assets will go out not only to the open pods, but also to the closed pods. Another difference is when public messaging goes out about open pods, we will not divulge information about our closed pods. It is the responsibility of each closed pod partner to contact the people that are associated with their organization or agency and inform them of when and how their pod will activate. So keeping in mind that the medical countermeasures plan originated due to biological terrorism events, the one that the state and the CDC is very particular that we plan for is an anthrax event. This is probably the most intense, not just intense psychologically, but labor intensive. And it has the most stringent requirements because we are required to get a 10-day supply of antibiotics to everyone in Tompkins County within 48 hours. The reason for this is inhalation anthrax reacts very specifically within the human body. And so once a person is exposed, the life expectancy is only 48 hours. And the symptoms, the early symptoms of inhalation anthrax mirror those of a cold, the flu, or even coronavirus. So it could take 24 to 48 hours of a few unexpected deaths to occur before anthrax would even be detected. But once it's detected, rapidly the county, the state, and the federal government are going to move into action. So when we think about what it would take, I'm using population data from 2010. It does not include the number of resident halls or what the capacity of the resident halls. So I called all three of the colleges, and this number is going to have to be updated when Cornell finishes all the construction on their new dorms. But right now, our planning factor for 8 months out of the year at least is about 114, 500, and 2,000. This does not take into account the people who work in Tompkins County, nor those who visit us throughout the year. That number is provided to the state in a percentage through various surveys that we submit. So when you think about the 48-hour restriction, or it's not a restriction, it's just a 48-hour goal, we'd have to dispense to 2,385 people per hour to meet that goal. Now, one of the things that we would do in this instance is we would use a concept called head of household dispensing. And so what we do is we divide our population number, I think it's 2.27, which is what the 2010 census provided. And what that does, it allows household members to come in with all of the screening sheets. So only one person has to show up at the pod to get the medications for the entire family. Under this, we would actually allow people to bring the information and get the medication for their neighbors and even family members that didn't live with them. So when we look at that number, that's still a big hourly number, but when you increase your number of pods and within each pod, you increase your number of dispensing stations, these numbers become more manageable. So let's talk about how this medical countermeasures fits in with our mass vaccination for pandemics. To be quite honest, it's not written for pandemics. But because we have agreements with agencies and organizations that can actually vaccinate their population, and we have facility agreements with different facilities throughout the county for mass dispensing, we can turn these mass dispensing sites into mass vaccination sites. But the big difference is when it comes to vaccinating during a pandemic, the vaccination is not readily available in the strategic national stockpile. So it's going to take some time. So the distribution of the vaccine, even after it's manufactured, is going to happen in waves. And the way that we decide who gets vaccinated first is based on a document called the CDC Tiered Vaccination Approach. And I'm going to show you that document. And I'm actually going to email this document to Kathy so that you could look at it. So the first thing I want to point out is this was based on influenza, not just any influenza, but a very novel virulent influenza. I think we're going to see some changes potentially to this document when the vaccine for COVID-19 comes out. So what I'm going to do is this can be confusing and misinterpreted. So I'm going to go over it piece by piece. So there were 4 categories, and each category, as you can see, is divided into population groups, and associated with each group is an estimated number. Now, these numbers right here are national numbers. This document has to get turned into a Tompkins County document. But one of the things that we can look at really quick and determine is we're not going to have a required to vaccinate that category of individuals. Even the National Guard personnel who, because we have a National Guard unit locally, that responsibility is going to fall to the New York State National Guard medical patient. So these numbers are going to have to be turned into Tompkins County numbers, and this is really important because we don't want to double tap. You probably didn't get to see, but in the lower categories, you've got just basic age ranges of people. So people could fit actually into 1, 2, or more categories. And we don't want to double tap because if we send crazy numbers up to the state that don't make sense, it could delay us getting our vaccine. So when we look at these tiers represent prioritization for vaccination. So tier 1 individuals are to get the vaccine first. Now, this is the part that confuses everybody. Yeah, actually, I'll admit it confused me. I had to do a little bit more research when I was first analyzing this document. So when we look at this, the initial assumption is that these severity, moderate, low, high severities are associated directly with a population group. Now, the one thing that is true, this is a method of sub-prioritizing the vaccine should we need to. But if we look at just adults 19 to 64 years old with a high-risk condition, and we look over at the high severity, why would it be green if for that population group, the severity of the disease is high? That's because that's not the way this document is meant to be interpreted, but it's very easy to think that when you first look at it. Actually, what these severity groups do is the CDC looks at the severity of the disease for the entire population. The other thing the CDC takes into account are community mitigation measures that have been implemented because of the pandemic. And so now if we think about this, the CDC could actually say, all right, I want everybody to create their vaccination plans based on low severity. Or they could say moderate severity, or they could tell us to do it for a high severity. And so now if we look at one population group, we can see that if the virus is at a high severity, that we would want to increase the tier on critical government infrastructure to maintain that infrastructure, because there's going to be a lot of other people who are social distancing, staying at home, not going out because of the severity. Therefore, we have to modify who gets the vaccine. And as you can see on a low severity or moderate severity for this particular group, they're not even looked at as getting the vaccine until all other 5 tiers have received it, because they fall lower in the category compared to the whole population, not just a category of individuals. And I can answer questions toward the end on that if that's still confusing. So I wanted to go over some information on open and closed pods. When we look for open pod sites, we're looking for places the community is familiar with, where there's good transportation. I've actually talked to the director of TCAT. He said in one of these events, if I provide him all my open pod sites, he will actually create bus routes specific to that community around that pod site for us. So this map is something that you'll get, but what I want to do is I kind of want to focus our attention to the right so I can discuss how to look at the map. So if you look over here to the right where my cursor is, you've got green, amber, and red. And these boxes denote the status of our planning for open pods. So we have 2 pods, one in Dryden, one in Newfield, TC3 and the Newfield Methodist Church, that have complete plans. So when I first came into this job, there were no pod plans. All there were documents where a facility might agree to let us use a facility. So it was only a facility agreement. In the last few years, what I've tried to do is develop pods that were very specific to that site, because I realized if we only have 48 hours to implement this entire medical countermeasures plan, if we don't have specific plans for pods, we're going to run into some trouble. So our pod plans now have facility contact rosters. They have organization charts that actually list the type of people and what the jobs are of the people who are going to support that pod. There are diagrams for flow. There's signs created, tells you where to place a sign. And a lot of these things are pre-made in a storage unit here now at the health department. So the places that we're still working on pod plans are in orange. And really, we have agreements, but some of these agreements needed to be updated. And for example, number 3, the VFW in Trumansburg, I actually have not visited it. So I have not yet made it a personal assessment on if that would be appropriate to get 4,900 people through in that town. And then the ones that are in red, the reason for that is twofold, actually. One is when I originally started work on this, I was told only to develop pod locations throughout the county 4 to 6. And then last summer, I was told, no, you should find one for every municipality. So I've had to add those municipalities onto the chart. So I have not gotten out to Groton, Enfield, Danby, and Caroline at all. But I have worked a significant amount of time on the town and city of Ithaca and gotten nowhere. It's been really tough to lock in agreements. It's been really, and until I have an agreement, I can't create a detailed pod plan. So if you look down here at this bottom chart, it shows the estimated number of pod workers that would be needed for a 12-hour shift. How I got these numbers, I could explain, but that would take too long. So one of the things I look at is I break down population data, and based on, I actually have time studies that I've collected through exercises. And so I have an idea of how long it takes to dispense to an individual person. And I've used that data to try to determine how many dispensing stations that I would need within each of the municipalities. And then based on that, I create an organization chart centered around those dispensing stations. And so my estimate is that we would need 390 people to support pod operations for a 12-hour shift, for a total of 780 in all. And we don't have but about 50 people trained, because that's my other barrier, is getting the support for training. So when we think about pod plant or closed pods, one of the things that I pitch to these organizations is it doesn't cost them anything. It provides them an opportunity to incorporate this concept in continuity of operation. And probably the most important one that catches their eyes is this third one. It eliminates their employees' time away from work at an open pod. So when they think about being able to keep their employees at work, because if not, all of their employees would show up at our open pods and they'd have to shut down their operation. To be eligible to be a closed pod, we need them to be in the footprint of Tompkins County. They need to have at least 100 resident students or employees that they can dispense or vaccinate. We do give the option of vaccinating or dispensing or both. And we do ask that if they're going to dispense, that they do it the head of household method to reduce the pressure on their pod also. To vaccinate, they have to have licensed medical staff, or they have to have a contract in place to prove to us that they have licensed medical staff that can vaccinate. And then we have to review their plan. What typically happens is I actually develop some of the plans for them if they don't have the ability to do it themselves. So when we look at our closed pod partners, we started off with 12 partners when I started this program 5 or 6 years ago. Some people have felt like they really could not pull it off. And so they've actually written letters and asked to be taken off the list. The good thing about Wegmans is Wegmans has offered to be not just a closed pod, but an open pod. And it kind of makes sense. They do have a pharmacist and they are able to vaccinate. We would have to request for some waivers to the ability of a pharmacist to vaccinate under emergency conditions, because they are stifled right now with what they can actually do. But with COVID-19, we have seen those type of waivers provided to pharmacists across across New York State, definitely, and then throughout the nation. Last, this is just to let you know about the things that get worked on in my office. I am an office of one, so sometimes it takes a lot of time to build these relationships with these open and closed pod partners. And then in addition to that, there are exercises and trainings. And then these are all of the plans that we have that either I have written from scratch because there was a need when before there wasn't, like Zika and Ebola. And then some of these plans required complete rewrites. And some of these plans, unfortunately, have not gotten worked on until the past couple of years. And that is actually all I had to present. Are there any questions? I know that's a lot of information.
Thank you, Nina.
Mark, what's our time here in terms of availability for questions? I did have one quick one, but I don't want to put us behind on our agenda.
Yeah, let me look here. We've got another hour. I think we could take a few questions. So I'll keep an eye on it.
Okay.
Go ahead,
Yeah.
Nancy.
Yeah, thank you, Nina. Nina's been a wonderful resource to us in our Trumansburg Ulysses community meetings to keep abreast of COVID and all things related. On slide 19, when you said that to do vaccinations, you'd require a medical personnel, would an EMT or a paramedic associated with an ambulance squad be considered eligible to do that function?
Under current conditions, no, they're not eligible. What we would have to request is a waiver to allow them to vaccinate. And more than likely, it will have to be under the supervision of an RN. But still, I've actually posed that plan up to the state EMS group.
Mm-hmm.
And the answer they give me is, when the event happens, we'll take a look at that, which I hate that answer. But it's the one that I've gotten.
Okay, thank you.
Because what I would like EMTs to do, I would actually like them to be able to vaccinate all first responders for me.
Mhm. Great, thank you.
Any other questions, Rod?
So how can we be helpful? I guess that's my question.
So when you get the slides, if you could take a look at where I don't have good pod plans, or I don't even have facilities identified. One of the things that would be nice that I've actually wanted to do, and I got to say thank you to Nancy for getting me in front of this group, because I've asked to speak to you guys for 7 years, and it's been a pandemic apparently. If there's just someone that I can work with in your community that understands the facilities within your community that could work with me and help me do site visits so that I could look to see about the suitability. And then once I get a facility and the owner agrees to let us use it, I'll create the plan. The other thing that you can do, and it's totally up to you, I don't see anyone from Dryden here, I don't think, I'm not sure, but I just trained the Dryden Citizens Emergency Response Team about a week ago on pod operations, because I have a completely different presentation that breaks down how does a pod operate, what do you need, what do people do, and I provide them the job action sheets, and I actually provided them with the plan for TC3 in case they were ever asked to support that pod. They can now take a look at what jobs they could fulfill and how that plan is supposed to work, and be a better resource even for the health department to execute. So if you happen to have volunteer groups that would be interested in pod training, I can conduct that training ahead of time rather than at the time of the event, which is never a good time to train.
On behalf of Dryden, we thank you for that.
You're very welcome, sir. Thank you for letting me do that.
Sure.
I have a question. Is all the medication in none of it's pills? It's all has to be shots. So we have to come up with a lot of people that are going to be able to administer it, because you talked about 100,000 people have to be insulin.
Well, so for mass vaccination, remember, it's going to happen in waves. So not everybody is going to get vaccinated at the same time. So we have some time to coordinate for that clinical staff. For mass vaccination, we'll also be opening up hospitals, doctors' offices will be able to vaccinate, pharmacies hopefully will be able to vaccinate. The critical aspect is when medication has to be given to an extremely large population, over 50,000 people. In a case like that, I actually have the ability to train anybody to dispense ciprofloxacin and doxycycline. So when it comes to dispensing the medication, there'll be waivers for, just like there would be a waiver for an EMT to vaccinate, there could be waivers for local citizens to be trained to dispense. And I actually have that training piece too.
So the Anthrax is something where you said the head of the family could come and get it. So it's more like a pill and they could be distributed that way. But the vaccines all have to be in shots.
Yes. Now, there's a caveat to that, because about a year ago, I started seeing about research on anthrax vaccine. And I know that there's some in the stockpile, and I just looked at that and I'm thinking, oh my goodness, they're going to want us to vaccinate and dispense at the same time. So I don't know where the anthrax plan will go from here. If they pull out the antibiotics and they just push the vaccine in there, that's a huge change in how we do business at the local level, because we don't have the resources to vaccinate an entire population in 48 hours.
Okay, thank you.
Great.
This is a little bit perhaps off topic, but I'm thinking of the immediate problem we have, and that's with COVID-19. Now, sometime, I hope, there will be a COVID-19 vaccine. It may roll out slowly. It may roll out all at once. How might this plan be applied if we do have a COVID vaccine, or is it really applicable?
It is applicable because some of our closed pod partners are actually responsible for those tier 1, tier 2 level people. And so they can take on that vaccination requirement from us. The other thing is like I said, a lot of these facilities that we've gone and set up for dispensing, we could easily use for mass vaccination. I like having the pod specific site plans ready. And my plans are very detailed. If there's supposed to be 12 tables, my diagram shows exactly where those tables go, how far apart they go, how many chairs goes per table, so that that kind of work can be done quickly by a group of individuals setting a site up.
So it might be wise for each of the communities in Tompkins County to identify sooner rather than later a location for a pod, so it might be applicable.
Yes, because if people are going to want the vaccine and we don't have something set up, one of two things will happen. Those people are going to be told to come closer to Ithaca or closer to where the pod sites are established, or you're going to be told that we got to do this really quick, find a place, we're on our way. And we don't want that. We'd rather not plan it out for you and have everything set up so that when they want to come down and vaccinate, it's all together.
2 possible sites in Enfield, so I'll work on them.
Okay, sir.
Hey, Nina, it's Gordon Hart from Trumansburg. How are you?
I'm fine, thank you, sir.
Let me know if there's anything I can do to help on the northwest end of the county in terms of pod locations. I found this presentation helpful. Also interested in your mass casualty plan when that's ready. But you mentioned the T-Burg VFW. That's actually in Seneca County, #1. So that I don't know if that would be an issue or not.
And different stories on that, so I'm glad you told me.
Yeah, it's in Seneca County, #1, and #2. As of a few days ago, their executive board is considering potentially selling the building. So there are issues, some large background issues with that facility. So we should talk and see if we can find a better location.
Okay, sounds good.
Great. Any other questions? So
you can always
certainly
email me too.
Okay.
So I'll be sending the slides and some other materials to Kathy. Thank you again.
Great.
Thank you, Nina.
Thank you.
Yeah. Wonderful. So we have our homework assignment to identify pod sites. Thank you. All right. So now let's move on to hear from Joan Jerkowicz from the County Planning and Sustainability. And she is going to speak to us about municipal planning assistance from that department. So Joan, take it away.
Thank you. I'm just here mainly to remind you about this program. We started it for the first time this year, or I guess in some ways restarted it this year, because it's a service we've provided in the past. It's been repackaged a little, but I wanted to let you know we're still going to be proceeding with the program next year. We had, as with everything this year, there were several bumps in the road. Things didn't go exactly the way we planned, but that happens. And so there was some material in your agenda packet. I'm not going to read all that to you, but I'll touch on a couple of high points. One, we kind of provide services in one of two ways. One is providing direct services to a municipality, which would be appropriate to maybe help with a plan or drafting a portion of an ordinance or something like that, where it's very specific to the municipality. It's not a general thing for everybody. The other thing we do is what we call our best practices reports, which is identifying, we would ask municipalities to identify an issue they're facing, and we would look at the best practices that might apply not just to that municipality, but to all municipalities or to different types of municipalities. So for some issues, you'd want to address it differently in a rural setting or an urban setting, or differently in a community that has, a planning staff and one that doesn't. So we would have, the report would address sort of the multitude of ways that issue might be addressed in a community. So those kind of are two tracks we have for that. If it's a direct service, we are going to ask that the municipality contribute half the cost of our time to work with them. But if it's a best practices report, we wouldn't charge anybody for that, because that's a service we'd be providing to the entire community. So that's just something we would undertake. The point of running that second one through this program is to make sure that we're addressing issues that local communities in Tompkins County are actually facing, and not something that we just think is a good idea. You know, that it's really based on what you're facing, issues that you anticipate having to deal with, and that we might be able to help not just your one municipality, but the entire community as well. So all we do to ask you to participate in this program is to just, we don't even have an application. You give me a call, you send me an email, or somebody on staff, I'm directing it, so it would be eventually get to me. But give me a call, send me an email, say, hey, I have an idea for something to do that you could help us with. We are setting up a deadline as we did last year, with the idea just so that people can think about it and that we would have a sense when we get to the deadline of how many communities are asking for what. And we're setting aside 200 hours of staff time to work on this. And that's basically the equivalent of one person working 4 hours a week on this program. It's not the way we do it. We split up the tasks among staff depending on what the activity is. And we are discussing a deadline of October 15th or thereabouts. We'll be sending out email reminders. We'll probably send out one soon, sort of announcing it, and then probably about every 2 weeks, a little reminder. Say, don't forget, we would like to hear from you, you know, by the 15th to help us think through what we need to do next year. As always, we know things change as they did this year. We had a project lined up and the municipality did not go forward. They were dealing with bigger issues, big surprise, and we were all dealing with bigger issues this year. That doesn't bother us, but that way we're available maybe to help another community, whether it told us during this, you know, sort of formal process, or that just, you know, keeps us informed, gives me a call once in a while and say, you know what, we've got this idea. Any way you can help us? And sometimes the answer is no, but sometimes the answer is yes, or sometimes the answer is maybe in a few months. So it really depends on what our staff are working on, what time we have available to help. So I guess I'll stop it there and see if anybody has any questions.
Great. Okay. Thanks, Joel.
Yep.
I was wondering if you had, what are examples of best practices reports that you might be able to offer or,
okay.
or you're thinking of?
One we did in the past, a few years ago, it wasn't through this program, but it'll give you a flavor of what I'm talking about. We did a report on ways local municipalities can regulate solar and wind installations, with sort of a best practices report, not what we called it at the time, but we had specific recommendations on things like height and setbacks and things like that, so that not everybody had to do their own research. So that's the kind of thing we're envisioning.
Mm-hmm.
We did get a request this past year for a report that actually would expand on that particular one, which is dealing with the incredibly large scale solar installations that we did not even envision when we worked on that first report, you know, the utility scale. We ended up working on that for a while, and then we discovered the state is working on something very similar. So we're just keeping our sort of finger in the pie by working with the state, but we're not doing the report directly. But again, that's the kind of thing. But it might be something like, okay, I'll share something because I saw someone stuck something on my door about concern with 5G network installations. So that might be an issue that every municipality is dealing with. And if someone said that's something they would really like us to work on, I'm not sure that's one we would actually do because I'm not sure that's our area of expertise, but we would look at it and see if it was something we could help with. Now, something like that it's not just a specific issue for a specific municipality, but might apply to everybody.
Sure. I know that the topic of development guidance on telecommunications has come up in our town, and I think we'd be interested in something like that. So, not
suggesting it because I don't want. No, I'm just kidding. But but that's the kind of thing that, again, not a site specific or a town specific issue, but something that's probably going to be dealt with by several municipalities. It doesn't have to be every place, but several at least.
Sure.
Joan, have you done something on short-term rentals? That's an issue that a number of us are looking at. I expect the town to take up legislation that I've asked the planning board to produce in the next month or so, once we hear back from you guys whether you approve the 239.
We have not done anything on short-term rental in terms of regulatory. I know a lot of municipalities in our community have, but some of them have did it a long time ago, and it's maybe not doesn't reflect the current state of practice of the marketplace. But we also have our toe in that water because the tourism program runs through our office too. So we look at it from another perspective.
Yeah, I could see a real need for some consistency because I think we're moving towards a patchwork system here where each municipality is doing something, but I think ours is going to look very different from what the city of Ithaca did or what Yucca Heights did.
It could be, and it might be appropriate to be different. Consistency is often good because it makes it easier on someone who's running multiple facilities. But I will say we are digging right now into, or not digging into, but we're looking to hire someone who can track that market for us and let us know who has short-term rentals, how many they have, how, you know, what's their sort of the total business. We're looking at it as from the perspective of making sure we collect room tax for those facilities, but that we would have data that would be available to municipalities to let them know how many such operations are in their town and who they are, and you know, again, how many of those kinds of operations, how many short-term rentals are operating in their municipality.
We would love for you to do that. I think for each town to try and do that, it would get very duplicative and expensive.
Yeah, we have identified a couple of potential people who can do that work for us, and we're just selecting someone that would actually do that work for us.
Nice.
Linda?
I don't know if you're probably not aware that the town of Ithaca and Cayuga Heights are actively talking about joining together, and Tompkins County is said that they will pay for the sort of baseline for software company like Host Compliance that will do exactly that. They will tell each municipality what properties are being used for Airbnb in their municipality. And then there are further services that you would need to pay, the municipality would need to pay for, depending upon monitoring how many times the property is being used as an Airbnb, and even to the point of being able to send out emails saying you're not in compliance, you know, this is the fine you have to pay, et cetera, et cetera. So that's all sort of in the works. And Cayuga Heights did this like 3 years ago, and I'm trying really hard to convince people to come on board and do it, because the more we have, the cheaper it would be for the extra services that are pretty impossible for a municipality to do. You need pretty sophisticated software in order to be able to monitor it.
Yeah, and actually that's being developed through as a joint services project. So the more municipalities that participate, the better.
Yes, yes. I think Cayuga Heights is the only one that actually has a law on the books at this point.
I don't know that end of things, but yeah.
We're trying to get there, Linda. I know you've been waiting for the town of Ithaca. So just maybe a variation on Joan, how you've thought about the MPA is, I think there's topics like 5G, like short-term rentals, that maybe when not everyone's going to be interested, but if we set up a system and the county planning provides some oversight saying, okay, this month, anyone who wants to come together and share what they're doing around 5G, the county could host that. So that might be kind of a different version.
Yeah, that's not something that this program was specifically designed, but yeah, no, that's a good idea. Just figuring out who's doing what and bringing everybody together. We do that a little informally with planning staff. We meet quarterly on Zoom these days, you know.
We want to avoid duplication of effort. So if we
Yeah,
what others have started to do, and the city and the town have both. Well, the city is very involved in 5G right now, and the town is not close behind.
Hugo Heights has been approached also, and we're communicating. And I would love to have opinions from other municipalities.
Yeah, I like that. Joel?
Well, I mean, this kind of brings me to thinking about the whole broadband access question, particularly for the rural areas. And it's my understanding that our representative for Danby and Caroline, Dan Klein, approached the county about your willingness to host or lead an effort to investigate the possibility of doing a fiber network. And there was a whole lot of receptivity there, but that's the sort of thing which would be much easier to do as a collaborative effort.
I will emphasize we're offering planning services, so we're not there for every possible intermunicipal issue before someone misinterprets my offer.
We're looking to plan for
yeah,
doing
just
this
saying
in the
the word
municipality.
plan does not help. I don't think you really want people who are not trained in a topic to try to take it on for you. We might be able to help you find somebody to do it.
Yeah.
I would hate to have someone who doesn't know what they're talking about doing something
Nancy.
important.
Yeah, I want to echo Ulysses' interest in if there is guidance or model ordinances related to short-term rentals. I don't know what our capacity would be to contribute to the inventory, but we certainly have a lot of that not only along the lakeshore, but throughout our town. And in attempting to resolve a complaint that we had related to a property owner in New Jersey who let her, rents out her place, and those people create problems for the neighbors. Tracking that down is, so we're interested in sort of how that evolves. The other question I had for Joan was, and Joan, this may sound familiar because it's probably been almost 7 years since I've been trying to put together the resources for doing a community plan in the hamlet of Jacksonville. Obviously, your county plan talks about node development. Our comprehensive plan does too. The Route 96 corridor plan calls for a special community plan. And even though we have a planner, I think we need, that can provide some support, but would doing a community plan for Jacksonville be one of the things you could consider that we could follow up on?
Absolutely. That's the kind of direct service kind of activity that we would envision in this. Is again, it would be specific to your community. And again, like I said, we would ask you to contribute half of our staff costs to work on something like that. And I will mention we started to do something like that with Newfield, and they were interested in doing more on the economic development side and planning. I'm sorry, no, on the design planning. And it ended up, we weren't a great fit for them, but we helped them get to the point where they were able to get some resources from Cornell to move forward. So we're also available to help get a community up and running enough for them to then run with the ball, so to speak. And, for example, we didn't charge Newfield for that work. I went to a couple of meetings and we just chatted. We didn't, invest a lot of time in doing the plan. So it can come out one of two ways. Either we do it directly or we help the community get ready to bring somebody on board. If it's beyond the scope of our staff, either our abilities or the time that we have to work on something.
It appears that Kathy Covert has an issue. I just want to say that we are having a storm come through and it's possible that we could lose power. So I just want to give you a heads up that this meeting could come to an end quite abruptly.
Okay. Thanks, Kathy.
Sure.
I'll throw out something. I really like this idea of facilitating planning efforts that we oftentimes all of us face, or we have a lot of common ground. And we all deal with this all the time. One issue that's come to our attention in Caroline in the last year is the issue of potential formula businesses coming to town, and so we're interested in examining something called formula business restrictions. And so it seems like, and I think this concern has been raised in other towns as far as, the impact of formula businesses on local businesses and the quality of life. So I don't know, is this something that you're familiar with, Joan, or does that seem like something that could have traction?
I'm not familiar with anything recently. I know years ago, some very, let's just say expensive communities have tried to address the issue. I believe Nantucket or Martha's Vineyard had basically regulated formula businesses. They didn't call it that, but kind of chains and things. They regulated them to the point that they couldn't, or else they literally did not allow them at all in their community. And it withheld scrutiny because of not because they were expensive, but they were unique kinds of communities.
Mm-hmm.
So I don't think that's something a municipality necessarily can do, just blanket, but
yeah, I mean, we're planning to explore this, just what these formula business restrictions can do and things like that. So I just thought I thought others might be interested, or I don't know, but tossing it out there. Great. Any other questions or comments for Joan? So we should be, I guess, sending you our ideas before your October 15th date, right?
Yep, just shoot me an email.
Okay.
Phone, call me up, although now when I'm home, it's hard to pick up the office phone, so.
Yeah, right.
Mike Murphy has his hand up.
Yeah.
I'm not familiar with formula businesses. What are they? Whether we should be interested or not, I'm curious.
They would be like chain businesses, chain retail establishments that
like dollar stores and all that.
Yeah.
Oh, we have those. Okay, thank you.
Yeah, sure.
I would like just to make one little comment. This is this program used to exist years ago,
Yep.
And it was a very helpful service that the county provided. So I'm really pleased to have the county re-embarking on it. So thanks, Joan.
Yeah.
I want to thank Katie. It was one of her priorities when she was put into the commissioner's position to sort of reinvigorate this program and do more outreach with municipalities. So.
Great. Okay. Thank you, Joan.
Thank you.
All right, so let's move on to our long-awaited subcommittee reports from the work we've been doing this year. We've got about a half an hour to go through those. So I'll start with the report from the Water Quality Subcommittee, and I see that George is here. So go ahead, George.
Hi, everyone. I actually got knocked off of this meeting by a big storm. Here in Connecticut. I'm in Connecticut, and we just got rocked, and I just got hooked up again. So
wow.
I missed most everything. The Water Committee did not meet last month, so I have nothing new to report.
Okay, thank you. Can you summarize what remind us what your recommendation is? At this point?
Well, we had a few. One was to get out as much information as possible about cleaning off boats before they go from one body of water to another, and that there's supposed to be some handouts being published. Honestly, I haven't heard anything more about that. I've kind of dropped the ball, I think. Another recommendation was to pool some money together to hire an overseer of the Cayuga watershed. And we realized when we suggested that it was highly unlikely due to everybody's financial situation right now. I can look through my notes to see what else we had.
I remember, I think last time Liz Thomas talked to us about,
Yes.
she was developing, exploring a funding model for the intermunicipal organization. Is that correct?
Yep.
Okay. Great.
That's all I got, really.
Okay. Thank you, George. I'll move on to the transportation subcommittee, and Bob's going to talk to us about that, I guess.
Yes, I have a couple of items to bring up. One of them is not on your agenda, but I do notice you talk about the Route 13 corridor. There's going to be a meeting convened by the county discussing the Route 13 corridor study. It's going to be online, and it's going to be Thursday, September 3rd at 6 p.m. And you can go to the county's website, and right on the front page, there's a story. It's got a link. You can register. I would encourage people to be involved in this. It seems like everything old is new again. I remember when I was reporting news on WTKO back in the 1970s, they were talking about rejuvenating Route 13. Then there was talk of a Dryden bypass and all sorts of fancy things that I'm sure we can't afford today. But in any event, they're going to be discussing it. It would be interesting to be involved. It's coming up in just about a week. So it would be what I'm going to be monitoring that. And I hope that other members of TCOG would as well. The other item is something that is in your agenda packet, and that deals with what the State Department of Transportation has in mind for the west end of Ithaca. And it's a doozy, I'll tell you, because I don't think it's going to work myself, my own personal opinion. I'm not a transportation planner, but who knows? But better we know what we're getting into before we get into it. And they're talking about what's called a west end couplet, which would be dividing Route 96 traffic, what's now West Buffalo Street, both eastbound and westbound, would be splitting it off so that what's now westbound traffic on Buffalo Street between Meadow Street and Fulton, in other words, between Joe's Restaurant and Green Star, all that traffic, that westbound traffic, would be diverted to Court Street, which would either be a one-way westbound road or would be 2 lanes westbound and 1 lane eastbound. But in any event, it's being planned. I think it's going to be dangerous because I don't think you're going to. I worry about the weaving on Meadow Street and the weaving on Fulton Street, just to be able to make the lane changes to negotiate continued travel on 96 up West Hill. So I think that we whose constituents live in the West Hill communities, Ulysses, Trumansburg, Town of Ithaca, and here in Enfield, have particular concern for that. Also of concern are people throughout Tompkins County whose ambulances have to get up Route 96 to the hospital. I think that could really bottle up westbound traffic on 96. So the bottom line is, I think we want to study it some more. I think we want to have, I'd like to see it be discussed by our transportation subcommittee, perhaps invite members of the state DOT to attend an upcoming TCOG meeting to explain the whole project and explain how they think it's going to work. The whole idea is that they want to impose these changes so as to facilitate the development of City Harbor and Carpenter Park in the city of Ithaca's West End, because there's talk about another access ramp coming onto Route 13 from the Carpenter Park vacant area there between 3rd Street and farther south. And to me, it seems like it's something that should be studied a lot in advance. It came before a city committee, Planning and Economic Development Committee last Wednesday. Most of us didn't know about this until it came up for casual discussion at the county legislature on Tuesday of last week. But it came before the city planning committee. They tabled action for a month. So we do have to act quickly on this if we want to take a stand. But I hope that everyone on TCOG will become familiar with the plan. It's on the city's website, so you can see what they propose. And I'd be interested in any feedback and any input.
Great. Thank you, Bob.
Thank you.
So yeah, and I'm just thinking as far as planning, our next TCOG meeting's not until October. So it sounds like doing something at that meeting. We'd have to schedule a special meeting if we wanted to address this issue in time. Is that right?
We probably would. I might be able to convene a transportation subcommittee meeting where all TCOG members could participate. We might be able to do that in September. I will work on it if I get the sense from other TCOG members that that would be something they'd like to pursue.
Well, I certainly would want to hear more about it from Ulysses.
I think it sounds like a reasonable concern. I agree. George?
Yeah, what Bob reported is accurate. What instigated this was the proposed developments at City Harbor and Carpenter Business Park. DOT thinks that the proposals are too big to make Route 13 traffic workable anymore. I mean, it's bad. Everybody knows it's bad now.
Mm-hmm.
But the city proposed a new street opening. I think it's at 4th or 5th Street. It would only be one side of the street. It would be on the west side. So it would empty the new development at Carpenter Business Park, which is considered, there's like 3 big apartment buildings and an office building. So the state is saying that that's not workable. And the city came back with plans to make it less automobile heavy. But the state, this is a state proposal, is saying, well, if you want us to do this at 5th Street, we will require, not suggest, we will require that you make these changes on Buffalo and Court Street between Fulton Street and Meadow Street. And Bob described those correctly. People in the city who live on the West End and who live in the Washington Park area, the blocks a little east of Meadow Street, are not happy about this either. Currently, Court Street is probably the safest way for a bicyclist to go east to west to get to the West End. And that could be jeopardized by this plan. Not to mention the businesses that are on that block of Buffalo Street and Court Street. And you can imagine how people would have to go around the block through some of the busiest traffic in the city to get to these places or to deliver from those places. So it's not really being embraced by city residents. The planning department is rapidly putting together opportunities for the public to speak. And I can forward those times to you if you'd like. If people could send me their email addresses, it'd be easier for me just to respond to everybody than to try to find everybody's email addresses because I'm so lousy with a computer.
George, could you send it to Katrina and she could distribute it to all of us?
Yes, I could. I certainly could do that. Yep.
Okay.
Please do
Great.
that.
If that's okay with her.
I
That's
hope
more work for her.
Fine with me.
And George, please keep me informed because there's often a very poor communication between the city of Ithaca and the outlying municipalities. And I really want to stay on top of this. And I think everybody on TCOG should. I think the next meeting of the Planning and Economic Development Committee, and I presume it'll be a Zoom meeting, will be Wednesday, the 16th at 6 p.m. But a lot may happen before then. So
That sounds right. And a lot of the public input, they're going to try to make happen before then. I think they're being way too optimistic that we can deal with this in a month's time. And I know that myself and Cynthia Brock are trying to put the brakes on a little bit because this would be a huge change. And I think what we really need is a traffic study. Because I mean, there's so many open-ended issues here. I mean, the new bridge hasn't opened yet. The bridge that will be at the end of Teganic Boulevard, that's going to change traffic patterns. There's plans for major development on Cherry Street. That's going to add a lot of automobiles. The east side of the inlet around where the Green Star used to be and where the restaurant used to be there, that's going to be developed. So my own personal opinion is the development is too dense and too big, but
yeah. All right, we should move on, but
all right.
Thank you, George, and thank you, Bob, for bringing it forward.
Thank you.
Great. So now I'll move on to the Energy Subcommittee, and I think Rod will talk to us about that.
Yeah, it will be a pretty brief report. So I think you'll remember that we decided to focus on community choice aggregation, and we have a goal of educating municipalities about that over the next few months so that at some point we can do kind of a survey or take a straw poll to see how many might be interested in moving forward on community choice aggregation. We had a pretty robust, aggressive plan of webinars and whatnot that it's been derailed a little bit, but we have done a couple, including connecting with CCA administrators to find out how they would potentially work with Tompkins County. Our next goal is to set up a webinar of other local government officials in other parts of the state to talk about their experience. So just stay tuned. You know, we always make sure that TCOG knows about those. And again, our goal is to educate all the municipalities so they can make an informed decision at some point. As those of you who have been involved in TCOG longer than I have know that this is not a new topic. There had been a subgroup. And so some members of the subgroup from 3 years ago, I guess, have been involved and are helping this as well. So stay tuned. We'll let you know when the next webinar is.
Great. Okay. Thanks, Rod. It's an important topic. If we could get, this kind of mechanism in place for our energy future. Great. So I'll move on to the next subcommittee, Emergency Planning and Preparedness, that I've been chairing. So we are putting forward the resolution that Katrina sent out this morning. That's a resolution urging Tompkins County Legislature to call upon New York State to allocate funding to local municipalities to support the provision of rural emergency medical services. And so I Rorden, would you like to sort of, Rorden really was it was his brainchild, this idea of this kind of that this was kind of needed. And so I was going to see if you wanted to present the resolution and explain it, Rorden.
Sure, Mark, I can do that.
Great.
I do have one heck of a storm rolling over my head right now, so
Okay.
the lights are blinking. So I don't know how long this connection will hold up, but we'll give it a shot.
Okay.
For those, I know this has been kicked around for years in various forms, but just by way of background, in case anyone isn't familiar, the Village of Trumansburg has a 24/7 paid paramedic-run ambulance department, which developed over a long period of time. Our first ambulance corps was all volunteer members of the Trumansburg Fire Department. But as is the case throughout New York State, volunteerism on the EMT side in particular is in decline. We're fortunate that our volunteer numbers for our fire company are actually up over time. We're not losing volunteers on the fire side. We have a young fire company, fortunately. But the requirements that New York State places on EMTs and paramedics to maintain their certification really puts a damper on the ability for folks with full-time jobs to maintain those certifications. So over decades, volunteerism on the ambulance side had declined to the point where the village went paid back in 2000, and by 2007, we were a 24/7 department. When this committee met and we began kind of talking about what in the area of emergency services did we want to focus on, it quickly became clear that it was fire and EMS that really needed the most help. The question was, how do we help? The old saying of "I'm from the government and I'm here to help." Well, this is a government issue, particularly at the local level. How do we maintain volunteerism where it still exists? Is it possible to increase volunteerism where it's dropped off? And so that was kind of the genesis for this discussion. I am strongly of the opinion, because I have been on the village board since 2007, and since I became mayor in 2018, it's become a hot button issue for me that the kind of standard answer that we get from a lot of places, which is, well, there must be something more we can do to try to put the genie back in the bottle of the loss of volunteerism. I don't believe that. I believe that once volunteerism has been lost, particularly on the EMS side of things, it's impossible to get back. And so for rural municipalities in particular, what is the answer? And I think that the village's model, whether we like it or not, because it is very expensive, and Nancy can certainly attest to that from the town of Ulysses, the model that we have of a municipally owned paid department that then is able to contract for services with surrounding municipalities as they need it is probably what most of rural New York State is going to have to do if they aren't already. And so that's been kind of a mission of mine for the last couple of years. I've had several conversations with state assembly folks and a couple of our state senators in our area, as well as with Congressman Reed, about what mechanism might we have to be able to support that model, because it is an expensive one. And out of those discussions, I've developed this idea, which you can read in the resolution. Hopefully you've had a chance to look at it. The thought was that the model already exists for supporting municipal infrastructure or municipal departments. And that model is CHIPS and STOA, Sea Transportation. Where those organizations, in the case of transportation, exist, particularly downstate, New York State has a funding mechanism to help support those local entities. We all get CHIPS money, unless the governor cuts it. We all get CHIPS money where we have roads. So the model exists. We don't have to reinvent the wheel. What we do have to do is convince Albany that EMS is not fire, that EMS is healthcare. And to me, that is the political hook for folks in Albany, particularly since it is an election year and we can talk red and blue, particularly since we are a blue state, which values healthcare very highly, not only the provision of it, but how it's paid for. How do we make sure that healthcare gets, how do we make sure we get people to healthcare, and how do we make sure we get healthcare to the folks? And there's nothing like a pandemic to highlight the fact that emergency healthcare is A1. It is one of the most important, if not the most important, frontline healthcare services that we offer. And so the gist of the resolution, and I'm happy to read it if anyone wants me to, but you all have copies of it. The gist of it is to kind of outline by bullet point those and highlight those facts that I've just stated. And then for this organization, for TCOG, to ask the county legislature to draft a resolution lobbying Albany directly to investigate. And as you can say, there's a lot of steps in this process if it goes well, but I think it has to start from the county level, that the lobbying effort should begin in Albany to really try to get puts folks on the spot and say, listen, this is a healthcare issue. These are your constituents. This is your constituent who has the 2-year-old in respiratory distress, and if they don't get paramedic level care, the kid's not going to make it. We have to make it personal. We have to play those cards, and we have to really get it in front of folks in Albany to have if we're ever going to make any headway on the broader issue, we have to get them to realize that it needs funding. How that funding takes place, devil in the details when we get to that level, hopefully someday. Whether it's funding to the municipal departments, whether it's funding to individual municipalities to spend on their contracts if they don't have departments, that can all get hammered out. But we have to get to a point where that conversation is held. I will say I'm aware of the EMS study that Irene Weiser put a lot of time and energy into a few years ago. I thank her for those efforts. The reality is, and this is not a criticism, the reality is that Tompkins County as a government and the city of Ithaca as a government does not have the need or the urgency to address this issue. The county certainly does not want to take on another large department, and the city of Ithaca gets great service from banks. So it's all the rest of us rurally, and Bob Lynch mentioned earlier kind of how the outlying municipalities sometimes don't get all the communication we wish we do. We also, I think, have to sometimes take a go it alone approach. But this is an opportunity for us to collaborate, I believe, through TCOG to get the legislature to look at this issue. So I'm certainly happy to answer any questions about the wording of the resolution. We did go back and forth on it quite a bit. Or if there are questions or comments about the broader issue, I'm happy to take those on as well.
Great. So I will take that as that Rorden has moved a motion for this resolution. Do you have a second on that?
I'll second it.
Okay. Great. And then I'll just point out that there are two asks in the resolution. Rorden mentioned one about lobbying the legislature. The other one is for each municipality to have their governing boards approve the resolution and send it in to their respective representatives to add to lobbying pressure. Dan?
I'll just add that we tried to get this voted on last Thursday, but our schedule was just too packed with some zoning issues and issues concerning Dominion Gas. So the response from my colleagues was very favorable, and the response from Dryden Ambulance was very favorable. So we'll get a vote on it in September.
Great. Good to hear. Nancy, you're muted, Nancy.
Sorry. I am supportive also, and we can certainly put this on our town board agenda. But I'm wondering, Rorden, in terms of building regional support, now that Jason Molino and Frank Krupa are in these Southern Tier control room conversations, whether or not they would be willing to bring this matter up with their colleagues, because again, as you say, it's a healthcare issue, and they're now talking regionally about healthcare, which is, I think, a very good thing.
Mhm.
And it may be an opportunity to sort of expand our the force of our ask.
Yeah, that's a great idea. I'll mention it to Jason. I will say I've also talked to Anna Kellis about it from the county legislature, assuming nothing crazy happens in November. If she is on her way to Albany, she has expressed interest in supporting this. Senator Helming to the north wants to, had offered, this was pre-COVID, had offered to try to arrange some roundtable type discussions among her colleagues in Albany. So I think that if we can, it's kind of an all hands on deck. If we can get the snowball rolling and efforts from multiple directions, then maybe this is the window of opportunity to actually see something get done.
Great.
Thank you for
Super.
bringing it. Are we ready to vote?
Yeah, I think we
All
are.
in favor?
So, okay, great. All in favor. So,
Aye.
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 And any opposed? Abstentions? Great. Thank you, everybody. I'll just mention quickly that we identified our committee, identified a couple of other actions that we are recommending. One of them would be to help municipality or do something collaborative to help modernize fire contracts at the municipal level, something that association has been presented at Association of Towns by Brad Pinsky. And so the proposal is we may reach out to him to see if he could do a training or something like that, or provide guidance on that. And then the third issue that we thought was important to address is developing and facilitating EMS training locally, perhaps with the county playing a key role in that. So I'll just leave, I just wanted to add those two in. Great. All right, so we are pretty close to 4:30. We should, our next meeting will be October 22nd. And do we have any proposals for the agenda for that?
Well, we'll see what happens with that West End couplet story, but that's a work in progress right now.
Okay, so I think if there is something, we could certainly put that in. And yeah, I'm wondering if we also want to, so we have the recommendations from each of the subcommittees, and so we should probably have an update from the subcommittees again about where things stand. Anything else that people would like to put forward for the next meeting? I'd certainly be interested to know any ideas that are forwarded to Joan at the county for what she was proposing today. So it might be nice to share that information.
Good idea.
Great. All right, well, Rod asked me initially if the storm had hit here. It's definitely hit here, and it's flooding rain right now, so.
Same in Enfield.
Great, so if there's nothing else, I'll call for adjournment of the meeting.
So moved.
Great, thanks, Betty. Okay, thanks, everybody.
Okay, thank you.
Yep, see you next time.